Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Sufficiently caffeinated. How about you?
Sufficiently caffeinated. That using words, man. Me too. Like I was saying, I'm on my fourth cup of coffee. It's been a long day. I don't know what's going to happen on this podcast, so this is just a forewarning for anyone who's listening to this episode. But you guys should be in for a treat, man.
Oh, yeah. And guess what coffee I'm drinking right now?
Uh-oh. What kind?
Original blend, baby.
Ooh. Nice, man. I like it. How is it?
It tastes really good. It's smooth.
I'm glad. I'm not going to lie. I'm going to admit something right now. I'm a little bit of a sellout, but I'm drinking the one where you just kind of put it in and you mix it, like the instant coffee. Because I had no time and I just put the instant coffee in and I mixed it up. So I'm a sellout today.
You're in a dark place.
I know. But let's get into the episode. I'm super pumped for a guest. We have Jarreds Boyd on today with us. Jarreds, this guy's got everything, man. He's doctor of physical therapy, master's in athletic training, strength and conditioning specialist, sports certified coach, track coach. You can catch him on the gram lip syncing occasionally. He does it all, man. So Jarreds, welcome to the show.
Oh man, thanks for having me. I really, really appreciate it. Super, super excited. Yeah, you can only catch me lip syncing. You do not want to hear me actually sing.
I love that video, man. I'm dying when I was watching it. It's great. How you doing today, Jarreds?
I'm good, man. I can't complain. It's been a long day already. It's only 3:11, but it's been a long day. But I'm doing well. Always grinding. I always got energy reserved somewhere.
Yeah, it's got to come from somewhere.
Yes, sir.
Why don't you just kick it off, man? Just give a little bit of background on yourself for our listeners if they haven't heard of you.
Yeah. So like you mentioned, dual degree with athletic training and physical therapy. And really, for me, my big background and passion is kind of in blending rehab, performance, and then also huge with the psychosocial aspect of everything when it comes to the athletic population, but also just the general population as well. So I kind of like to merge things together so the things don't appear to be so much of a dichotomy when we're looking at the rehab and performance realm and the clinical practice. I'm also a track coach, like you said, as well. So I love track and field. I love speed, performance, and sprinting as well. So trying to optimize, not necessarily just for sprinters, but also any kind of athletic endeavor. I'm really passionate about that. I'm always looking to grow. So critically think, and that's what I try to do on Instagram as well, trying to invoke a little bit of thought and really kind of trying to bias or challenge my biases as well and reflect a little bit.
I was laughing because I think I might need your services.
Yeah, is that right?
I need a little help with my track.
Hey man, we can do it. What you need? You want to get ready for the 100, the 400?
Oh, I don't know. Doing the powerlifting right now. So
I was gonna say, man, I just saw you pull like 405. I don't think you're sprinting the 100.
I'm not going anywhere fast. That's for sure.
You might have good acceleration though if you moving some weight like that, right? Yeah,
that's true. We're sticking to the positives here.
Exactly.
Jarreds, you kind of touched on how like you're always growing, you're always learning. That's something that you really pride yourself on. How has that kind of changed since you got into your dual degree in athletic training in physiotherapy school, and like how have you seen yourself kind of transition into implementing the biopsychosocial approach and all these other things into your care?
Oh man, that's a fantastic question, and it's something that I'm still continuously every day with every patient learning and really trying to self-reflect and see what could I have done better, or maybe I need to say X, Y, and Z a little differently. So it's a continuous effort to try to appraise, how you're doing, and if you're getting what you're attempting to gain out of patients. But for me, I would say a big thing is really trying to surround myself with people that kind of have similar mindsets, but also have ones that seem to oppose how I may think about things and my beliefs as well. So, I think for me, the growth has came from leaving my initial job, which was where I was working with a doctor of osteopathic medicine and a personal trainer and a massage therapist. And that environment wasn't conducive for me from a growth perspective. Initially, actually, is what I thought. But when I look back on it, that was like the impetus for me to actually grow, because again, everything really contradicted my thoughts and my beliefs, but it kind of really allowed me to dive deeper into the literature and the research and to understand the value and the importance of the biopsychosocial model. Because where I was initially, again, it was very all about the biomedical and mechanical, anatomical, structural lens for a treatment perspective. And so when I finally left, I was able to kind of really, really realize that my experiences was necessary in order for me to grow. So I think that was really valuable for me. And I know a lot of people probably go through similar scenarios, whether it's at certain clinicals, whether you're still in school, when you hear maybe certain things that may not reflect the type of population that you're working with when it comes to the didactic portion of things. And so I think it's good to appreciate those experiences and then be able to draw from them to create this more like aerial viewpoint of, how you appraise yourself, but then also how you implement certain principles and methods into the clinic.
Oh man, there's so much to that statement. I think the first part and the last part you kind of touched on there was like you're obviously a very reflective person. Mm-hmm. You talked about kind of like appraising how things are going in the day and stuff like that. I think that's a super important thing for younger people trying to implement a biopsychosocial approach, because it's challenging and you're going to screw up. So I'm just curious, like, is that something you like? Do you have a way you do that? Do you write things down, or is this more like a thing you kind of just rehearse in your mind at the end of the day? Kind of how do you go about that?
Yeah. So for me, I used to write things down, not necessarily about appraisal, but more so about just different thoughts or analogies, ways to explain things that I need to look into more. But when it comes to like the appraisal, it's more so like that intermittent type of reflection during the entire day. And then definitely doing like a huge debrief at the end of the day when I'm driving home. So for me, and it kind of happens very quick, and it's almost innate for me at this point, to where, let's say I have an initial evaluation, and once we're done, that's something to where I kind of quickly can discern kind of whether or not I felt like I did like due diligence, so to speak, whether it's with the exercise prescription or whether it's with, more importantly to me, the communication aspect, and all the variables that go into the communication with the patient, and whether I did a good job of explaining things. And a lot of that really can come from us really being very aware of the patient's like demeanor and behavior and their responses to what we're explaining and describing and how we're communicating things. So some of it kind of takes some time, and at least for me, of picking up some of those little subtle cues. But that's kind of how I found value is really trying to, after each, especially initial evaluation, doing a quick debrief and analyzing the situation so that I can, make better decisions in the future.
Yeah, that's a challenging, the initial evaluation in particular, because it's like you're just starting to get to know somebody and they're coming at a vulnerable place where there's so much to cover. Mm-hmm. You can't possibly cover it all. And I know like,
absolutely,
for myself, I've kind of like caught myself over educating, like if I could sum up my last like 6 months,
oh man,
that's something I'm constantly working on, like trying to get out of that kind of trap,
Oh yeah. So absolutely. It's so funny, that you say that, because, and I get in the same type of situation as well. And I definitely have students that will come and they really kind of fall into that, because we want to demonstrate and show how much we know, but not necessarily only how much we know from an egotistical perspective, but also we want to be able to educate, because we think the more we give them, the better they're going to be. But sometimes it can be so overwhelming that it's hard for them to make a move in the right direction, because they're hit with so much information and they're not sure which one of those will play the biggest role in their success. So that's a challenging aspect, but to me, it's kind of the fun part as well of trying to understand and delegate the importance of certain principles within treatment for that particular individual. So it's kind of just navigating the waters, really, when it comes to that. But it is definitely a challenge for sure.
Yeah, when you get that look from the client and they're just like giving you that eye, like, man, you got to chill. I don't know what you're talking about anymore.
Yeah, right. Absolutely. Yeah. Absolutely. It definitely gets like that. And I've tried to get better with that in regard to, really letting them talk a lot and only picking up off of like two subtle things maybe that I think would be like the lowest hanging fruit of, okay, they said this, let me inquire a little bit more about that, and then offer some education or some advice if they're willing to allow me to do that, and if they are in a position where I think they're actually going to receive it as well as implement it. That's kind of how I see it.
Yeah. Yeah, that's a great point. That permission to educate is something, again, me and Will did a podcast talking about like what we want to work on in the next 6 months. And that's definitely one of them, like making sure people are ready or they want to hear what we have to say and not just kind of dropping it on them.
Right. Yeah. Because it can be so abrasive. Like, wait, what do you, and to a certain degree, it might come off as, at least I've experienced this, as we are devaluing their experiences because we're saying, well, no, the research says X, Y, and Z. But I think it's important to validate their experiences. And then, like you just said, ask if we can offer a different perspective, but still appreciating what they're experiencing at the same time. Yeah.
It's a great point. I feel like that's a tough thing to balance. I feel like I struggle with that quite a bit. But yeah, let's transition a bit into this principles over methods idea. That's one thing that me and Will really enjoyed about like your content and just following you for a bit now. Can you kind of dive into like how you came up with that, why it's your philosophy, and why you think it's important for us as a profession to be adopting like principles over methods?
Yeah, for sure. Man, so for me, I think that really just came about from, I really like to have things that are structured in a way that is easily implementable, as well as digestible. And I can delineate between, the most to the least important and trying to attack low-hanging fruit, so to speak. And so I think when we think about principles and methods, obviously, in social media, but not even in social media, just in school in general, there's this concept that methods are the most important, and that's all we need to focus on. And the one that knows the most methods and has all these different tools is going to be the most successful and have the best results. And a lot of times it's more appealing to people, right? Because we think of methods as a lot of tools in the tool bag, taking a lot of different courses, having a lot of different certifications, knowing different strategies. And so it's intriguing to a lot of people. However, if we focus on that, then we tend to kind of lose sight of, well, what is our intention? What is our rationale? And we can find ourselves in positions where, if we're faced with some type of a quote unquote roadblock or difficulty in the clinic, how do we navigate ourselves out of that situation onto something that is leading the patient in the right direction? So, for example, thinking of a method such as, we'll just use FRC. That's the first thing that kind of comes to mind. There's nothing innately wrong with FRC or other said methods. But if that's the only thing that I know, and that's the only thing that I value, and I don't have my principles set into place, then if the techniques and strategies of FRC aren't eliciting the results that I'm looking to acquire or for that individual to attain, then how do I navigate myself out if I can't go back to my principles and say, okay, well, what is it that we really need to prioritize and emphasize, and what is actually important? If I have my principles in play, I can say, well, I'm trying to have them acquire X, Y, and Z. And so FRC, this particular method doesn't seem to be working. Let me then go perhaps to my toolbox and choose the appropriate tool that actually fits the particular task that individual needs, or that's warranted for them to be able to have success. So principles really just gives you that framework and that foundation of security, and understanding, again, the intent and the rationale behind what you're doing, and not getting so caught up in the fancy, flashy, new, cool courses and certifications and superfluous types of exercises that, again, they're novel, and innately human beings like novelty, but sometimes that can detract from things that I think are more important. And those are the principles that we have set in stone that are unwavering, and they should not change.
Yeah, I think that's a tough one, because a lot of those tools that you're mentioning they're kind of sexy, and it's way more appealing than regressing an exercise because it was a little bit too much load. You know what I mean?
Oh yeah, for sure. Absolutely, definitely, absolutely. And it's like all these different methods. And again, I don't mean to say, oh, these methods are worthless, because I think you can implement whatever you like, again, as long as you understand how and why and what you're trying to achieve. But some of them can make you relatively myopic as well, and really make your lens so limited to where we're missing the big key point. Right? Because it's like, oh, I'm just going to gravitate to this. And especially if we think about biases now, it comes into play. Well, oh, I just took this one course, so I have recency bias. And so now I'm going to use this particular method. But what about the other method that might go better with your principle, but we lose focus on that? So it's all kind of things that human behavior, I think, plays a part in regards to just our tendencies and things that we desire, which it can be challenging to try to kind of hone back a little bit on those things and really go back to the basics and the foundations.
I know you mentioned 6 principles. Were these just kind of cultivated over the time of your career as a physiotherapist and a trainer and stuff? And how have they evolved from when you first started to where you are now?
So I will say, a lot of the principles, the 6 principles that I have, those were created through essentially myself, but also with Rehab to Perform staff. And so a lot of those were saying, okay, what is the environment and the makeup demographically look like for us? Who are we really seeing and treating? And then what do we value? And so I think when you're coming up with principles, it's understanding what does my population look like on the most part, and then to make sure, again, because principles should be things for the most part that don't change at all. They're always there. They're always set in stone. As opposed to methods, again, you can they're interchangeable. And so it's that, but then also understanding what you actually value as a person, but then also what you've seen to be important and having the most success. And so, the principles that I have, the 6, are more conducive to the particular makeup of the individuals that I'm seeing in clinic. And the principles that I have don't have to be necessarily principles that everyone has. I think principles should be relatively individualized, based off of these themes that you constantly see and the types of situations you might find yourself in. So they should have some degree of science, some degree of like less ambiguity as a method might, and again, have your values in place.
Yeah, I think that's a really big point, right? Because like one of the big things about like the biopsychosocial approach is like making sure we're adopting like to the individual that you're working with, and everyone's going to be different. So that kind of goes same with those principles, right? Like the population that I'm probably seeing at my clinic is not going to be the same as what you're seeing. And then the principles should be based off of that so that you're providing like the best quality that you can to the population that you're seeing. I think that's a really good point. And that just, the thing about that, I think, is it becomes more challenging, right? Because it's not just black and white. You got to actually sit down and think about it and try to evaluate like what's going to be the best for the people that you're seeing.
Yeah, exactly. That's so true. Because then we love to try to make things, and it's normal tendency to try to make things black and white, because it makes it less chaotic, less random, and a little bit more organized, like no or yes, sort of thing. It's dichotomizing the situation to a certain extent. And, for the human individual, it's almost seen as like less of a threat. We're always talking about threat from a pain perspective, but it's really threat in general. And so if things are less chaotic and more organized, we feel less threatened and we feel like we have more control if it's black and white. But that's not the way of the world, and especially not the way of the actual person that you're treating in the clinic. So we have to get very accepting and tolerant of the uncertainty of things, as well as the ambiguity that the patient might present with. And that's why I think principles can be very, very beneficial. But again, it's about, saying, okay, I'm going to accept that there's going to be times where I might not know the exact answer, but this is what I do know. And I think that puts you in a position where you feel, more confident and less apprehensive about saying certain things or making certain decisions to the patient, as opposed to feeling like you have to be 100% accurate and right, and kind of placing your pride, really, really high in the forefront, as opposed to putting it to the side and saying, hey, I'm okay with the fact that there's some things within the case that present as challenges from a psychosocial perspective. But, again, that's just the human nature.
I'm sure we'll get into like a lot of these, like, or at least a couple of these principles. The one, I'm curious to hear you explain the movement options.
Yes.
Because just to give some people maybe a sense if they're unsure about what you mean by that.
Yeah, for sure. That's probably one of my favorite. So movement options really just comes down to, and this is kind of how I'll explain it to patients as well, in a way that will really resonate with them. And it's all about, I try to avoid using terms that are like flexibility or mobility. Not that those are bad. I don't want to demonize those by any means, because they can resonate with some patients more than others. So I think we have to be aware of, again, the individual that's in front of us and what they will understand and comprehend. But I think those terms already have like these preconceived thoughts and notions that kind of are attained or attached to them. So when we use something novel or different, then we can attach our own type of definition for the patient to understand. So movement options is more so about what is your joint potential, meaning what positions can you access or attain in order to meet the demands of your particular activities, whether that is from a sport performance perspective or from activities of daily living. So, The reason when we say range of motion and we're looking at these quote unquote standard norms and we say, the shoulder has to be 180 degrees and the hip needs to internally rotate this much and externally rotate this much. Well, that's, fine, I guess, to have a relative standard, but not every person needs to meet those norms, which to me, yes, they're objective, but they're relatively subjective because who are we standardizing that off of when we know every individual is different? So I'd rather go with, what are the goals of the individual? What are their current complaints? And then when we're doing the assessment, it's our goal and our job to determine whether or not they have the movement options or the joint potential in order to attain those types of requirements from the goals that they have in place. So it's almost like if you look at the alphabet and you say, hey, what's your movement vocabulary? Can we reference letter A to letter Z? Or are we limited and we can only reference letter A to letter M? So if I'm limited in the amount of letters, then I'm going to be limited in the amount of words that I can create. And so I'm going to be limited to the amount of sentences and the amount of paragraphs and then the amount of pages and the amount of books, because everything's going to be very, very redundant. It's going to be the same words over and over. It's going to get boring. But right, if I can reference A through Z, now I have so many letters, so I can create so many words, so many sentences, so many paragraphs, so many books. And so it allows me to be more robust and less redundant. And so now I have more potential variability within the body to be able to meet the demands of my activity without being very rigid and redundant with my movement. So that's essentially what we're thinking of when we say, hey, providing the person with the movement options, again, dependent upon the task that they need to presume.
I love that alphabet analogy. That's a good one.
Thanks, man.
You're also like providing them variable options in the event that one of those options is sensitive.
Right. I love, that's it. Yes, absolutely. That's fantastic. That's so true. Yeah, it is. It is about that. Yeah. So, and then with that, it's like, okay, well, we want to make sure that we give them or provide the body with the joint potential of the movement options, but then how do we create just a little bit of a buffer, right? So that we're not just, that's good enough. No, I don't want to be just good enough. We got to give them just a little bit more, especially depending on their goals. If they're going back into some type of athletic endeavor, then we know we need a little bit more room or excursion to play with, because we do get into certain positions or scenarios that might be more compromising to the tissue from a load tolerance or load capacity perspective.
Cool. Yeah. Cool.
Does that kind of come back? I know you talk a lot about like, it doesn't always necessarily about like overloaded tissue, but also like unprepared, like being underprepared, the system being underprepared.
Yes.
Kind of come back to that.
Yeah, it definitely does. It's actually funny you say that, because I just had a patient earlier this week for a new evaluation. She's a runner, and she used to run a lot, and she kind of stopped running as much, and so she wanted to get back into, or she was doing more Soul Cycle, which is basically like Cycle Fit and spin classes. But she said, yeah, I'm in because I have bilateral knee discomfort. It's not really, really bad, but I'll get it if I go over around 10 miles, I believe it is. And she did a 10-miler, and that's when her pain had gotten exacerbated. And so we kind of talked about what her mileage was, and she was only usually doing, for like the past 2 months, a total of, I think her weekly mileage was 6. So she would do like 2 miles 3 times a week, and sometimes up to 3 miles for one specific run. And so some people will say, oh, well, she's overloaded because she has knee pain and she's a runner. Well, no, she's actually underprepared because she, ran a 10-miler. So yes, she may have overloaded her tissue with the 10-miler, but the impetus of the overload came because of the under preparation to be able to handle the amount of loading that she would undergo from a volume perspective during that run. So, for her, it was like, hey, we don't really need to reduce much. And we don't need to do a lot of calming things down because her sensitivity and irritability are relatively low. So what we needed to do was come up with a plan that would allow her to increase the size of her bucket, to increase her capacity or her ability to handle volume as well as intensity with certain runs she would do. And so it was about preparing the tissue to handle the load because she was underprepared. And so that comes a little bit from movement variability, but it also comes from the principle of enhancing her metabolic capacity from an aerobic perspective. We need to just gain a bigger aerobic base to be able to handle the volume that she was going to undergo.
Yeah, and that's a question I wanted to talk to you a little bit about too. Is like I remember one time talking to Steph Allen about this, and she said, I don't know if she got this from you, but just being how we need to, if people come to rehab, they shouldn't be losing their like aerobic capacity or their capacity to do things. We should be able to enhance that or at least maintain it while they're rehabbing a certain injury or a certain thing that they're dealing with. Can you dive a little bit into like maybe why that's important specifically for the athletic population? Obviously, but do you find that you can layer that into like the general pop also?
Oh, it's so important for both populations, hands down. So when we think about enhancing metabolic capacity, really what I'm trying to get at with that is more of the aerobic capacity. And meaning this principle actually goes back to movement options or variability. So if, for example, someone comes in with a lack of variability. And let's say it's an individual that maybe has non-specific low back discomfort. I usually like to use the word discomfort and not pain because I think it has a negative connotation with it. But so discomfort. And so what will happen is typically there's a perception of threat. So we actually lose variability or we lose our degrees of freedom because it's easier for us to manage the amount of motion or options available to the system. Right? Does that make so if I have low back, I'm just going to become more extension oriented, potentially, or more flexion oriented. I'm going to have just one bias again because it just limits the excursion and the amount of the amount of degrees that I have available. And so a lot of times with that, secondarily is if I'm moving less, I'm likely not going to want to partake in any kind of cardiovascular movement. And so that might then increase the level of pain experience that I'm having with low back discomfort. And so I say, well, if we can enhance metabolic capacity and do some low-level aerobic, we can actually open up the pathways for movement variability. If I have stress, typically with any stress, I'm going to lock up into more, again, extension or lose my degrees of freedom, not just with low back pain, but any type of threat or stress. If I'm running from a bear, then I don't need a lot of options available because my brain is just like, oh, no, I'm just going from here to here. I need to get there as fast as possible. I don't want to have to worry about all these huge ranges of motion. So, and again, that's just because of the threat. The same thing with pain. If we have pain, it's a threat. But if we increase their aerobic, then we can open up the variability, make them less rigid and less anaerobic. And so now if I have more options available, I start to feel more free, less rigid, less stiff, less perception of tightness as well. And so that allows me to feel better. And then also, even for the general population, aerobic capacity or that aerobic base is going to be helpful just from a perspective of all the other hormonal and systemic responses that may innately come that help to dampen the pain experience. If we're thinking of endogenous opioids and things that kind of say, hey, let's, like endorphins, kind of quieting down the pain experience a little bit. From the athletic perspective, it allows me to have better recoverability in between bouts of anaerobic types of episodes. So if I'm a repeat sprinter, a lot of soccer players or football players, and I need the ability to recover in between. Otherwise, if I stay at this heightened state of anaerobic in between bouts of activity, I never get a chance to truly calibrate and buffer certain hydrogen ions and other chemical and physiological cascades that build up in the system. And so now my fatigue levels increase, and we know fatigue can be associated with potential susceptibility of injury because it changes the way we navigate and maneuver on the field or on the court. And so that's why I think the aerobic piece is so beneficial, whether it's general population or whether it's the athletic populations. It builds that base and it makes you less apt to tap into the more higher intensity reserve from a physiological perspective. So it makes you more robust.
Another one of the principles I wanted to talk to you about was this idea of like cultivating self-optimism and why that's such an important thing for the rehab setting.
Yeah. So that was probably the most pivotal one for really thinking about success. And all we're looking at for that, like a lot of people have talked about and a lot of people are kind of moving towards, is this concept of how do we facilitate internal locus of control, meaning how can we allow the patient as well as the athlete to take ownership over the outcomes of their care. So yes, we have an influence over it, but ultimately we want to make sure that we put the ball in their court and they're the ones that are really making a lot of the decisions, because that a lot of times is going to be the impetus for true success, but not just success for the short term. I think a lot of times we just look at things short term, but I think it's going to be success for long term and really having them to retain the information and education that we've provided to them. So that was all about, hey, the patient should be in a position where they can confidently say, I am resilient, I'm adaptable, and I can be able to achieve the goals that I want and that I've set forth. And so we do that as physical therapists, chiropractors, athletic trainers, personal trainers, just healthcare in general, and movement rehab professionals by being the people that really say, hey, these are all the things you're great at. These might be some opportunities for us to maybe expand upon, but you do a lot of things really, really well. And so it starts to make the person feel more like, okay, I can do this, as opposed to being presented with information that is only in a light that kind of reflects negatively on what they cannot do. And so, yeah, the cultivating optimism is a huge piece that I think, again, we're doing a better job of, but I think a lot of times it's missing, and it doesn't create, this anti-type of fragility or this type of decrease in apprehension that people really, really need in order to perform the things they want to, with having that mental, physical preparedness.
Yeah, you sort of alluded to the idea that with cultivating that comes, I guess, giving away some of your control as a therapist and trying to, I guess, allow some choice and kind of decision-making with the client. I think that's something that we have a lot of trouble with. Probably comes from a good place where you care so much, you want to make sure everything's going perfectly and they're doing everything the way you think they should be doing it. So I think that's a challenging thing. And then on the other side, you're kind of talking about the pointing out the positives. And I think that's also difficult because we're taught to kind of differentiate all these things and these movement dysfunctions, so I think it's very difficult for people to adopt those sorts of principles, but I think that we should.
Yeah, it is very challenging because, like you said, it's something that is taught onto us. And so, you think about, all the biases and the fallacies that come with, when we put a lot of money and time and energy into things that got us where we are. So, for example, like loans for school and the amount of time it takes, we're going to believe in that system even stronger. And so our belief is, okay, what I was taught is accurate and right. And so my goal and objective is to find find certain, like you said, quote unquote, dysfunctions. And then from there, my job is to fix or correct those dysfunctions. And so I think it comes down to, an educational system that doesn't put us in the best positions or spots initially to truly help our patients out. And then secondly, it's like we talked about earlier, it's that self-reflecting and appraisal as well as to, is the language and the verbiage that I'm using really conducive and setting a good stage and foundation for this patient? Again, not only in the short term, because in the short term, they might do well and not have any discomfort because they're, following those core exercises that you gave them for their low back, because we think that, they need a particular series of TA exercises, and okay, well, they happen to get better. But what if they, they get better in the short term, but then they get some type of a flare up in the future, months later, years later. And then they say, oh, well, it's because I didn't do my core exercises. My core is weak now. And now they get into this mindset of feeling like their core is weak and they are not in the best position to be able to perform X, Y, and Z activity that's meaningful to them because of their thoughts of their core being weak. And I have to do my core work first before I do the exercises that are meaningful. Although I would say that doing the meaningful activity will likely elicit a positive response more so than doing the core exercises. So, it just comes back to, well, again, we got to set the patient up for success early by the verbiage that we're using and not setting out to find these dysfunctions, but instead saying, hey, these are the things you're great at. I'm extremely glad that you are doing X, Y, and Z, and that, you took the right step in the direction of coming here. My goal is to kind of be a facilitator and help guide you, but I want to make sure that we approach this as a team and that I'm meeting your expectations. So, what do you think is going on? What do you think you need in order to reach your goals? And then that's, come up with a good type of a plan of care and treatment process going forward. And then lastly, which I don't think a lot of people talk about, is those are your goals. That's fantastic. My goal is to help you reach those, but I have some goals for you as well. My goal is to make sure you leave here knowing that you are adaptable and resilient, and to making sure that you're confident and you don't have any reservations about performing anything you want to do in life. That's how we create optimism, and that's how we create people that are fearless when they leave the clinic, and they're not afraid of having pain experiences in the future, which innately will happen, and they're part of life and they're okay and normal, and they understand that.
Yeah, that's huge, man. That I liked how you said, like your goals as a PT, like for them, like that's big, I think, and communicating that after they communicate what maybe their goals are for physio. That's awesome. I'm definitely going to implement that, because I think I talk about it, but being more direct with it, being like, hey, this is like my goal for you, and like how can we maybe come together and bring these goals, your goals and my goals together as one, and kind of work in that space. That's good. I like that.
Yeah, I appreciate it. Yeah, I try to be relatively transparent with my with the patients that I see. That's something that I just kind of slowly figured out as of late that has been beneficial. And it's funny because I saw something on social media. I can't remember. It was like maybe a few weeks ago, but someone was asking another person, I can't remember whose post it was, but they were like, hey, do you use directly, like, do you actually say graded exposure to your patients when you're using that type of a principle? And again, this wasn't, I was just kind of looking at the comments, and I said, yeah, for me, at least, I definitely use it. I think it's okay because I like the patient to know exactly what we're trying to do. I don't have any secrets or want to hide anything. And I think the more they know, the more they're educated on, and if they understand the plan of care and my intentions, then it resonates with them more and they buy in more, and they trust me more. So it's like, yeah, if you're using graded exposure, tell them, hey, we're going to slowly expose you to challenges that are more difficult in order for you to be able to meet the difficulty levels of certain activities that you want to do. But over time, it's not going to be as difficult because your body's going to adapt and you're going to be in a position to be able to tolerate it and handle it confidently.
Yeah. No, and just to touch on something you mentioned before, like, I think, you know, one of the things with physio that we struggle with is this idea. I think we talked about it earlier in the podcast, was like how we have to be uncomfortable or comfortable with the uncertainty. I think when we're not comfortable with the uncertainty is when we start adopting these methods to try to find fixes for these things. And then when we adopt these methods, then we're now adding on an external locus of control potentially to the client, which is then taking that, you know, that idea of self-optimism away from them. Meanwhile, if we kind of fall back on principles and accept that maybe we don't necessarily have everything figured out, but what we're going to do is try to take what this person has in front of us and give them the best based off how they're presenting and having those things that we know we're going to fall back on, I think is like a way better way to approach it.
Oh my gosh. Yeah. Completely agree. Yeah, for sure, man. The complexity sometimes comes out of the absence. Right. So like if there's things, it's just like, oh man, things look unremarkable. You look really great. This looks good. Listen, you know, like we might be thinking this in our head, like, man, I can't find anything. Shit. Like what? All right, I got to make this. Okay. So like your sacrum is here. And so then, you know, your diaphragm here is doing this. And so then we got to get to this oblique in order to do that. Like we start making up just this crazy shit that is really like, what are you talking about? Like, no, that is just silly. And then we start giving these superfluous exercises that are non-meaningful. And again, the complexity came out of the absence because of our insecurity as a person. So we feel insecure and we want to show like, no, I got this. I know what's going on. And we make up these scenarios and situations, and then we put patients in positions that are not conducive for their health. Yeah,
I think it is an insecurity, and it's because you often look like you kind of said, the absence of kind of doing something or saying something, it looks like you're doing nothing. Mm-hmm. Like a good example is like if you're teaching someone to back squat the first time, like it's probably not going to be perfect,
right?
But you're going to maybe give them one key thing and just have them do repetitions.
Yes.
You know, because that they need the repetitions, and from a motor learning perspective, they need that kind of time to sort of think about it and then retry it so that they're learning. But if you're just looking at the therapist, I mean, you're kind of standing there. Mm-hmm. You know what I mean? But I think you have to be confident about that, in that you know what the point of this is. You know what I mean?
Yeah, I do. And I think a lot of that comes down to as well of like of not being in a position where we have the mindset that, no, we're facilitators, we're not fixers. So when we fail to adopt that mindset, then we're, again, going to always feel like we have to locate something or correct something. And if there's nothing that appears to be in a position that has to have some type of a fix, or then we will, again, make something up because it makes us feel better and more secure. You know, it's a vulnerable position to be when there is nothing relatively apparent. And I always find that students have challenging times. The students that I've had, you know, when a patient comes in and things look really great, joint potential is there, you know, coordinating movement options look really good. We're thinking of just like the fundamental movements, squat, hinge, push, pull, rotate. I kind of throw sprint in there, to be quite honest, but you know, certain things that they may need for their task, everything looks good. And so they kind of look at me like, I don't know what to do. And so I'll say, well, tell them what looks great. Like, hey, things look really good. These are the complaints that you're having. I think what we can do is kind of give you a little bit of advice on maybe how to change up X, Y, and Z. All right, so maybe it's something to where it's a load management issue, or maybe it's something to where it's a small little tweak in your programming as well. And maybe we kind of slowly take this out, add this in, and then give you back that exercise or movement or position that was once an irritant or a provoker to your symptoms. But I don't think we have to search for things. Sometimes there's nothing there, but it's like, stop playing hide and seek.
Yeah. And I mean, and that sums it up, man. Like, that's why it's so important to have those principles, right? To fall back on. Cause like, if you don't have that, then you're just picking things out. Like, you feel like you have to.
Yeah. I definitely agree, man, for sure.
Man. All right. To wrap it up though, I know you have like a big influence on like students, and, you're big into like clinical education and all that. I think like getting this type of information out to new grads and students that are in school to at least start to cultivate these ideas and these thoughts in their heads, like, I think is major key to seeing that shift. So like, what would be maybe one thing that you would like tell a student to like maybe think about or focus on or try to adopt as they go through their education and step out into like the real world of physio?
Yeah, this is something I've been trying to think about a lot. And I would say the number one thing, and it changes week to week, I always have different thoughts, but I would say right now at this very moment, it would be read books that do not pertain directly to rehabilitation, healthcare, physical therapy, but read books about the human organism and behavior. I think that will probably put you in a really, really good position. Things that might indirectly kind of carry over into the clinic and as a professional, but then also as a person. I think if we prepare ourselves from a personal perspective, it will innately, unequivocally transform over into our professional beings. And so, from there, it's like right now, I just finished this book called The Upside of Stress, which was absolutely amazing. And there's so many parallels that I can draw from that to the clinical setting. I'm reading a book right now that I just started, How Emotions Are Made. Right. So that is something that is very fascinating. It's all about the brain and how emotions are made, and, the different types of scenarios and situations in which they may emerge and why they come about as a nature and nurture. And so I think if we start to read more books about that, like different areas maybe of the body and or just about the human person in general and different cultures, sociologically, psychologically, I think, that makes you a better individual and human being. Personally and professionally, you'll definitely reap the benefits of that, and obviously your patients will too.
Man, awesome, Jarred. I appreciate that. Why don't you just let people know where they can find more about you, like your Instagram, like your website, maybe the website to like your clinic and all that good stuff?
Yeah, so you can find me on Dr. J. Fit Boyd on Instagram. I try to stay relatively relevant on there. It's kind of challenging to keep up with everybody posting so much, man. But I'm trying to do a good job with that. And then rehabtoperform.com is where I work and where we kind of have some blogs on there as well. And I'm currently working on my own website that should be up in the next few months. And just continue to try to grow. And my email, if anybody ever wants to reach out or has any direct questions pertaining to anything in general, is jfitsboyd@gmail.com.
Sweet, man. Thanks so much for coming on, Jarred. I know you got a lot going on, busy guy, but we appreciate you taking the time to talk with us. It was awesome, man. I thought there's a lot of good things that I took away from this. So I'm hoping some other people took some good stuff away from it as well.
Yeah, I appreciate you too for having me. It was a pleasure and an honor.
All right, man. All right, Jarred, we'll talk to you soon.
Yes, sir.